Okay, let's talk about this healthcare heroes thing. That term was definitely more widely used during the beginning of the pandemic, but even to this day, I still see signage in hospitals and in other facilities portraying healthcare workers, be it nurses, doctors, technicians, therapists, they're healthcare heroes. Hi, my name is Jeff. I'm an occupational therapist who makes free content on YouTube, but also on my website and podcast. Be sure to check out the links in the description for more helpful content. Let's get functional. So I did a deep dive into this term and started looking at the research. In Cox's article titled Healthcare Heroes Problems with Media Focus on Heroism from Healthcare Workers During the COVID-19 Pandemic, they define what hero is in the sense of how it is used during this pandemic. Typically, the actions of heroes are those that go beyond the duty of the agent, and while their actions are good, they are not strictly required. Heroic work involves a voluntary involvement with a degree of risk to help others. And it need not be physical risk either. It can be personal sacrifice that may cause unwanted financial loss or even social status loss. This makes me think, are parents heroes to their children? Well, in contrast to the concept of an angel, which has been portrayed before during the pandemic, heroes are often those of divine power and ancestry that has actually been used historically to describe political and military figures. I've been wondering, so why the sudden label of healthcare workers being heroes? Take nursing, for example. They are routinely, basically every shift, exposing themselves to diseases, i.e. MRSA, C. diff, tuberculosis, the list goes on and on. They put themselves at risk when they handle needles and risk the potential of a needle stick and getting infected with a disease, say HIV. But I guess that was considered part of the job before. Now with the pandemic, is what the work that healthcare workers such as nurses are doing so different that they suddenly are heroes? Does this minimize the work that healthcare workers did before? I am sure they saved some lives here and there before as well, before the pandemic, right? The HIV AIDS in 1980 or more recently in 2003 with SARS. I don't remember healthcare workers being perceived as heroes then, and those were pretty serious diseases as well. According to Stokes, Parish et al. In the article Angels and Heroes, the Unintended Consequences of the Hero Narrative, the commentary of heroism creates an unintended consequence of undermining professionalism and serves to disempower and silence nurses. It may even portray healthcare workers as having superhuman attributes. Does it feel like this term has kind of been phased out lately, especially by the media? Well, what happened? Did healthcare workers stop becoming heroes? In some cases, I think they have been treated the exact opposite. In one CNN interview of a doctor who's fighting to save lives is literally getting death threats from families of COVID-19 patients. He reports feeling demoralized as he experiences even hostile situations from these families, often who are very demanding. Yes, demanding unproven medical treatments or declining proven therapies. So, healthcare hero? I don't know. Maybe heroes don't know what they're doing after all. Not only is this not how it works, but this kind of behavior and attitude from these patients and families and their decisions can be putting healthcare workers literally at more risk. In the article by Halberg et al. Titled We Are Not Heroes, the Flip Side of the Hero Narrative Amidst the COVID-19 Pandemic. This was a little bit earlier study during the pandemic, but basically it was a Danish study in which one participant, what stood out to me was their quote, "I absolutely do not feel like a hero. Quite the opposite. When I say where I work, people automatically take 2 steps back," end quote. This was earlier in the pandemic when there was much more fear and no vaccine was even invented yet for COVID-19. So according to these participants, they don't feel like heroes at work, nor do they feel like heroes when they're off duty, but the media or the public or somebody is portraying them to be healthcare heroes. I mean, I even see it in some hospital, like I said, mentioned, or facility signage. So this is coming not from the public or the media. It's got to be coming from somewhere within the system, healthcare system. I have to agree with the author Cox's point about how this public narrative of heroism fails to acknowledge great responsibility by the broader public. That is the responsibility of all of us, the general public, and how we each have a part to play in reducing infections. in getting vaccinated and reducing the strain on the overall healthcare system. The problem with labeling healthcare workers heroes is it kind of puts all the magic in healing on the healthcare worker, doesn't it? Who are there to save the day, when in reality, they're getting burned out and they're doing the best they can. As we saw with the earlier PPE crisis during the earlier side of the pandemic, us healthcare workers were faced with making things work despite not even having proper equipment to protect ourselves from the disease. In a way, it kind of takes the blame away from, say, the healthcare system, doesn't it? Overall, individual heroism for healthcare workers as a group does not ultimately encourage a systemic response to the pandemic and does not put as much of the responsibility on the general public. Another potential problem of the healthcare heroes narrative is that it minimizes or discourages acknowledgement of all of our emotions. That is, the healthcare workers' emotions that include, say, anxiety, fear, depression, loss of hope, while they are either on duty or even off duty. I think it's important to recognize the work of all of the healthcare workers, but also even the support staff and also our frontline workers, everybody else. Why not call the checkout clerk or the UPS driver or the truck driver or the teacher a hero as well? They are literally putting themselves in some form of risk as well every single day even, and I think they should be acknowledged just as much as healthcare heroes, because that's what keeps our economy, that's what keeps our society functioning. I think Cox concluded their article really nicely and stated that rather than praising all healthcare workers as heroes, we need to critically examine as a society what duties we think that can support them. While we cannot control what the media says, and they often say ridiculous things, in my opinion, I think taking these types of signs that are portraying these things at these facilities would be a good start in changing the narrative to something that actually embodies what healthcare workers feel and what they do. So I decided to see what people on the internet had to say about healthcare heroes, and I saw some really interesting comments on Reddit. According to this one comment, veteran here, groups are only called heroes to prime the public to not mind their deaths. Nurses dying is bad, but heroes dying is expected for the greater good. They never called us heroes because they want to reward us. To the contrary. The old saying, when people start calling your profession heroes, prepare to be screwed over. Clear Skies 24 said, anytime someone called you a hero for the job you do, it's so they can pay you less. Dem 827 said, it was literally repackaged wartime propaganda. Van Therion said, I've always felt the heroes rhetoric was because it had an implication of what heroes do. They sacrifice to pay a little bit of tribute, but also to normalize people about the pain and death that happens to quote unquote heroes. If you don't have a choice of whether you're sacrificing something, that isn't a sacrifice. It's coercion. It doesn't make you a hero. It makes you a victim of implicit violence and the system. And Batty Witch said, nurses died of COVID is something that makes headlines and isn't very palatable. But heroes sacrifice their lives to protect others is something that makes headlines and people cheer for. We were only heroes because it was more palatable. So what do you think about this hero narrative, especially if you're a healthcare worker? Do you embody it? Are you split and in the middle? Or are you not a big fan of all? Let me know in the comments below. If you found this video interesting, give it a thumbs up. And don't forget to subscribe to my channel for more occupational therapy and healthcare content. I'm Jeff, the OT Dude, and have a nice day.